Hello everyone, Dr. John Bartemus here with the Functional Medicine Minute. Today I want to address antibiotics. Do you take antibiotics? Do you have children that you give antibiotics to every time they get a cold or an ear infection? Do you have children that have chronic ear infections, that have allergies, that have asthma, that have autoimmune disease like type 1 diabetes? Well, Dr. Martin J. Blazer, a medical doctor and 30-year researcher of antibiotics and bacteria, has a hypothesis and believes that the overuse of antibiotics in our society is what's driving chronic diseases like allergies, asthma, autoimmunity in our society today. Now, the antibiotics are driven, or the antibiotics that are driving those things are the prescribed over-the-counter antibiotics like amoxicillin and Z-Pak, but it's also the antibiotics that are dumped into our food supply by agriculture. Agriculture in 2011 purchased 30 billion pounds of antibiotics to give to chickens and cattle and pork because a subtherapeutic dose of antibiotics increases growth of those animals. Increased growth means more meat, means more money for agriculture. So think about what you're buying at the store, because those antibiotics in that meat end up on your plate and lead to potentially increased growth of our children. Has obesity increased or decreased in our children? Think about it. So you want to be careful when taking antibiotics. We have healthy bacteria in our gut called probiotics, and these healthy bacteria also live on our skin, and they provide immune defenses for us, they provide vitamins for us, they provide all kinds of health benefits for us. When we take a broad spectrum antibiotic like a Z-Pak or amoxicillin, it kills the bad bugs, but it also wipes out the good bugs. And by wiping out the good bugs, your immune system's taking a hit, your energy systems are taking a hit because the vitamins they provide are no longer there, and many other things are taking a hit from a health standpoint. So what alternatives do you have? Well, probiotics are a great way to support your microbiome. Eating lots of fiber and fruits and vegetables are a great way to feed those probiotics so that they can blossom and recolonize your gut if you've taken antibiotics. Waiting a few days when you get sick or when your kids get sick before rushing to the doctor for an antibiotic prescription. Many of the colds and earaches and things that our children get and that we get are actually viral. So if you prescribe an antibiotic for a viral issue, it will have no benefit, but it will have the negative impact of potentially increasing antibiotic resistance to medications. Alright, so I'm Dr. John Bartemus. I'm here to promote the healthy growth of your microbiome and the prevention of wiping that microbiome out by overusing antibiotics. If you get a major infection, then yes, and it is bacterial, then yes, an antibiotic may be warranted. But that antibiotic doesn't just wipe out your biome for that week that you're on the course or however long you're on it. Studies have shown that it wipes out the good bacteria for 6 months to 4 years and beyond. So anytime you take antibiotics, you want to make sure you're taking probiotics and practicing the lifestyle measures necessary to feed that healthy microbiome. I'm Dr. John Bartemus. If you'd like to learn more, check me out on my podcast called Accelerate Health with Dr. John Bartemus on iTunes. Have a great day.